Hey everyone, I am so happy to be talking about this topic. This is the NCLEX prep that you have been waiting for. We're here, brought to you by our partners, KenyanNurse Consultants, and we're going to be talking about prioritization today. This is the largest topic on the NCLEX exam, so this is the review that you do not want to miss. But we have a heart for our nurses in Africa because we know that you are going to make a tremendous difference for those of you who come over to the US. So if you are desiring to come to the US, this is also the broadcast for you because I'm going to tell you how to make that transition so easy. So easy. We have taken care of everything that you need to come over. And of course, we've done it by way of our partners. And if you didn't hear this, this is big news. We did it a couple months ago, but KenyanNurse Consultants have partnered with Remar Nurse. So I want to bring in the founder of this amazing organization, KenyanNurse Consultants. He is also a nurse by profession, so he can speak directly to what it is like to transition from your country to another one. His name is Nurse Paul Smiyu. Hello.
Hello, Professor. It's a pleasure having you here with us again. And I'm really humbled to have this session with you today. And for those nurses who are joining us today, I'm Simi Paul RN, the Managing Director and founder of KenyanNurse. And KenyanNurse is the consultants firm that is majorly to support nurses who are looking forward to relocate. And it does so by working with you through the whole process. I do that with the whole heart that actually I can actually be able to share out. Why? Because myself, I'm a registered nurse in Kenya and I've walked the whole journey. And currently I'm practicing in the UK. With that experience, I do understand that making those steps, it needs people who are able to support you. And that is why, as Kenyans, we've gone a mile to look for a wonderful NCLEX trainer, the only one from the US, that is Professor Regina, to partner with so that we can bring these resources close to you and be able to be accessible to you and be able to work with you not only through the training, but through the whole steps. So our partnership with RIMA takes the power back to you. I do understand previously several agencies used to actually make the process look so hard and so expensive. However, with our partnership, we're here to make it easy for you. We're here to make it possible. We're here to take the power back to you. And as she's going to explain, you're going to actually find that this exam is so easy, so doable, and you are able to pass this exam because you must pass the exam. You must pass this NCLEX and become a USRN if you're going for US. If you want to go to Canada, you can still use the same exam. If you want to go to Australia as a nurse, you can still use the same exam. And the beauty of it all, we are not only supporting the registered nurses, we are also supporting the enrolled nurses who are looking forward to do NCLEX practical nursing, maybe to become licensed practical nurses in Canada, to become licensed practical nurses in the US. We are able to work with you. And with this, it means this is your home and you are welcome. We're going to work with you step by step, and we shall be able to ensure that you become a US RN, Canadian RN, or US Australian RN.
Now, Paul, I love that you have the actual experience of walking the journey, and you talk so passionately about that and how some nurses in the past may have been taken advantage of, or they may have thought that it is a very difficult, too long process for them to undertake. Can you talk a little bit about how KenyanNurse Consultants is going to make that process, that journey easier for our nurses that come on board?
Yes, having walked the process, I've actually gained so much experience. And with that, it means we as Kenyans, we're going to work with these nurses from the first step when they are looking for that information. We're going to have webinars to demystify all the fears. After that, we're going to move on to the first phase. We're going to call them 3 stages. The first stage is for you to become a licensed nurse in the US, because if you want to practice in the US, first of all, you must be licensed. That's going to be our first step, our first objective, our first focus is to make you become a USRN. The second step is to ensure that you are able now to access the employers, you are able to access the job. The third stage, which is stage 3, we now have these employers, these US-based employers give you the visa, which is also coming with a family visa. And that's the beauty of the US. You are able to relocate with your kids who are up to 21 years, unlike in the UK where you need to have kids under 18 years. So if you allow me, I can take you to stage 1. In stage 1, it has various licenses, various phases. The first phase you're going to do is obviously to enroll into the NCLEX training that is offered by Professor Regina. And it doesn't matter whether you are an enrolled nurse, you are a registered nurse, all of you guys have the training that is offered by Professor Regina. So as the training is ongoing, we as KenyanNurse come in to support you now to move on to phase 2, which is CHFNS registration. This is just to validate your documents to ensure that you have the valid training, the valid registration, and actually you deserve to practice in the US. So once the CHFNS, which takes about 2 months for everything to be done, they're going to issue you the CES report. This CES report is to confirm every document you have. Then we are going to move with you straight away to State Board of Nursing. You're going to choose whichever state you wish to practice in. You can have Texas, Ohio, you can have California, whichever state you wish to actually settle in. We're going to help you, guide you on how to register in that state. And once you have registered with that state, we are also becoming smart. We are able to apply through Pearson and State Board of Nursing at the same time. This is to ensure that you are able to move in this process faster. Within 2 months, you have ATT from Pearson, you have ATT from State Board of Nursing that you actually desire to settle in that state. Once you have those 2 state authorization to test, we are able now to move in so fast to take you to now phase actually 4, which is the Pearson exam booking for NCLEX, where we actually guide you to have that exam be booked. Unfortunately, in Africa, we now have 2 exam centers, one in South Africa, another one in Kenya, home, and we are welcoming all nurses from Uganda, from Ghana, from Nigeria, from Zimbabwe, Zambia. At this point, I have to be patriotic a little bit and try to market Kenya as a center that you should think of coming to see that exam for. So this is just a roadmap that can actually tell you how you're going to process this process of becoming a USRN. And the story here is you are able to become a USRN within 6 months. And it's doable, it's practical. It's practical. How is it practical? As I've told you, within 2 months, that is your first month, once you come to us, we are going to immediately commence your CHFNS registration. By 2nd month, you have your CES report. And most nurses are getting their CES report within 1 month, within actually 3 weeks, or 4 weeks or 6 weeks, they have their CES report. So on your 3rd month, every nurse is going to be able to have commenced State Board of Nursing registration. We are going to process Idondoko. We're going to do the registration with that state, and you're going to get ATT. And as I told you, what we are now doing is we are now becoming more smart. We are processing State Board of Nursing together with Pearson Fu at the same time. That buys you time. So with this, it means you are able to process Pearson VU and State Board of Nursing within 2 months. You have the authorization to sit for your exam. And with this, we are now able to book for you the exam. Remember, as you are doing this, if you are able to look at the top, as you are doing this, your NCLEX training is ongoing. You are still going through the training, sharpening yourself, getting those methods, those tactics that you're going to learn, Professor Regina, on how you respond to these questions, on how you can apply your critical thinking, on how you can apply your judgment to answer each and every question so that you have high chances of passing. And statistically, Kenya is actually doing well. Statistically also, the new generation NCLEX has higher pass rate than the previous actually generation of NCLEX. With this, it means you have high chances of hitting this NCLEX. On your first attempt, you have your license. And with our partnership with RIMA, we are here to hold your hand and ensure that you have this USRN within 6 months. And
Oh,
for today, let's look forward on how we can learn so much from Professor Regina on how we can tackle prioritization, delegation, and assignment. And I do understand as a nurse myself, this is one of the critical topic in NCLEX. So if you are booked soon, this is your day. If you've
this,
booked 3 months to come, this is your day. Let's prepare, let's make ourselves ready for Professor Regina so that we actually save on all the wisdom, save on all the knowledge, so that we take this knowledge to the exam room and come out of that exam room with a license.
awesome. And so I hope that you are listening, because what Paul is talking about is the ability for you to do what you may seem to be impossible. And the reason why we're so confident is because Paul and I, we see it happening. We see nurses who are passing this NCLEX every single day. I actually have one of those nurses here, and she has such a beautiful testimony that if you just give her 5 minutes, I'm gonna give her like 5 minutes today, and then I'm gonna bring her back. She might have her own show, because there's somebody here watching that needs, you're here for a reason. You need to see that it is possible. So I'm gonna add Remar Nurse Faith to this broadcast. How you doing?
Good, and you?
I'm doing so good. I have about 350 nurses watching. Okay. I need you to tell them, what is your fantastic, great news?
Okay. I'm officially Rema North after testing 2 times. I mean, with everything all by myself. A single mom.
Yes.
Never planned to be a single mom in a country I know nobody, but I found myself in that situation. I couldn't believe it, but it happened. Starting from domestic violence shelter to starting working, from working, starting to bring all my paperwork for evaluation. You know, God keep on sending helpers. Everyone that I expected to help me, they failed me.
Ooh.
All the people that I know from my side, all the aunties that are like, oh, okay, they are nurse, they're going to put me through, they're going to help me. Nobody was there. I was in the midst of strangers. Strangers were helping me, people from Ethiopia, from Kenya, they were the one encouraging me. One of them was the one that put me through on how to register with CGNFS. I don't know anything about that. I don't even know I didn't even know the next street. Until I started going out. I was going from one office to another begging for help. But what is my story today? My story today is this. Did you see this? I bought this.
Okay.
I bought the old one when in 2021 or 22, I bought it and I kept it. I bought the sandals, the big one is not here, it's in my room. I bought the big one. I don't know where to start from. Should I start from the middle? Start from the beginning? Where did I start from? I started to read it. I don't know what I'm reading. And I dropped this one. I didn't even look at it. I didn't even open it, because I take NCLEX to be so huge. So you need a huge thing, a big book for you to understand it. I'm like, well, I don't think there's anything here that can help me, right?
Oh no.
So I dropped it. And I continued the journey. At the time, the first time, I was following all the questions, all those Q-Bank questions. I was jumping from one place to another. It didn't work. So I contacted my sister. Oh, somebody passed it with Kaplan. Kaplan is the best. This one, I spent all the money that I'm suffering, standing 10 hours. I keep on spending money. I keep on spending. If I tell you how much I've spent to make this come to pass, is almost $5,000. If I start,
Oh,
yes, I'm telling you the truth. I'm not lying. I'm not making it up. So I went to
okay.
buy Keplan.
Listen, there is an easy way to pass NCLEX and there is a hard way to do
Yes,
it. I'm
yes,
so glad we're listening to your story. You did it the hard way. You got the results, but the people that are watching today, Nurse Faith had to do it by herself. You don't have to. We have somebody right here,
yes,
KenyanNurse Consultants. They will help you with the paperwork. They will help
exactly,
you. Remar is going to help you study. But go ahead, tell us your
exactly.
story.
So this book, when I felt the second time after using Keplan, within 2 months, I read all the 2,000 questions in Keplan. But like you said, you normally tell us that all these Q banks is not the best for us because they have different questions, and they have you, as in you jump from one question to another. You get a question concerning a medication. The next question you will get is concerning childbearing, is concerning pregnancy. Another question you will get is concerning schizophrenia, as in everything is splitted. You can't even join them. And that was what I went through. And I went again thinking, oh, this time around, I'm going to come out, because I was going through a lot. I have a child that I'm taking care of. I am the only one taking care of this child. And I went in, it happened again. I'm like, what? I
Yeah.
wept and I cried. And I'm like, okay, what am I going to do? How do I start? Somebody directed me to someone that is from my place, and she collected $500 from me. And I told her all my stories, just the way I'm telling this story. I was weeping, everything I went through in the hand of my ex, all the blah, 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 to like see if she can help me. And all the money I've spent, she still collected that money from me. And guess what? She comes this week, next week, she doesn't show up. She shows up this week, next 2 weeks, she doesn't show up. I was not the only one. We were a lot of them. But look at you, my one and only professor that have babies, that have kids. You show up every day, every Wednesday. You even want to be showing up every day of the week. It's just that maybe people will not even be there for you. But you are ready. You were every... Jesus Christ. Then let me now tell you how it all started, how I got back to you, my professor. January, February, March, I fall sick. My BP was low. That was when I was diagnosed of depression and anxiety, and this is my medication. This is my medication. If you look at this one is mitrazapine. Mitrazapine, you know. This one is sertraline. I don't sleep. It started from when I was in domestic violence shelter, but I take it to be that all that I'm going through, but it continues. I was going down. My spirit was going down. My soul was going down. But I have a child. How do I do this? One day at my working place between March, I wanted to faint. They have to send me home. I couldn't even drive. And that was how my journey started. And before then, I've been following all kinds of pastors, praying this one, pray God, as in God help me. But this time around, I went back to God. I said, between me and you, as you are using those pastors, I know you can use me. Show me a sign that you are with me in this journey. I started praying. When I saw you, I'm like, God, this is the person for me. This is the God thing. She knows that I need prayer and this thing, not only reading. I need prayer and this thing. And as soon as God started showing me a sign, an angel started visiting me. I started seeing angels visiting me live. They were showing me sign. I wake up, I see feathers, white feather on my pot, on top of my pot. I wake up, I see 2 white feathers in my bedroom. I don't have chicken. I don't have bed. I don't have anything to collect with feather getting inside my house. How is feather, white pure feather, getting into my house? Who is doing this? Who is coming to me? I said, God, if it is you, show me a sign. Direct me on how to find a way to get to this exam. I don't want to fail again. I have no one helping me. I have nobody. I have no husband. I have no one encouraging me. And guess what? The Spirit of God directed me to where I kept this old quick fact. I picked it up and opened it, and I saw your code. I scanned it, you popped up. And you started your Monday motivation. I'm like, God, is this the person? How do I do it? I started seeing testimony. Testimony was flowing like a river. I'm like, no, is this real? And people were like, this is real. It happened. I said, God, if it is real, I am the next. That was how I started following you. And you told us that stop jumping from one teachers to another. It's going to confuse you. Immediately, I stopped the one that comes once in a week, once in this. I stopped him and I consistently followed you.
Amazing. How long did you study? You got the V2. Show me. Open it up. Did you do it? Did you fill it out? Is it filled out?
Yes.
Guys,
did you
this is the V2. I see. You did the work.
So,
very good. Very good.
Professor Regina, at my working place, I'm reading. I'm working with one hand with computer. I'm writing. I'm reading.
Nice.
These are paper towels from my working place. See,
that's what.
See, I'm driving with one hand. See, I did my V2 I did my V2 within a month. I finished the V2 within a month. Yes, this is it. At my working place, I'm writing. See, you send the one that we can download, right? We have to download. See.
Powerful testimony.
See the ones that we download. The one you asked us to download. We downloaded it. Yes. We downloaded and I printed it out. I filled everything out. Here.
Very good. See that? Very good. See? Yes, I do. That's
see the back of the book. So I used something to tie them. It's a lot. So it's not the pregnancy. I started with the free trial. You said we should start with free trial. When I started the free trial, I'm like, I think I have to get the whole of it. I started the free trial. I joined in the Rema University. Yes, that one.
Now listen, I have to tell everybody, I'm going to bring you back because we have to get into prioritization. It's such a big lesson today.
Yes.
But I wanted you to come on and just be a light to somebody today. You have overcome extreme difficulties coming to the U.S., being a nurse, you're not knowing anyone. But the main point of your story is that with God, it's possible. With God, it's possible.
Yes.
And so I just appreciate your perseverance. Okay,
yes.
I appreciate
it. Yes.
I will message you. You will hear from me after this broadcast. Okay.
God is real, Professor. You are real. God is real. V2 is real. NCLEX, as in quick fact, is real. Everything when I passed, within a week, I lost my voice. I couldn't speak. Nobody, my family, everybody my mother has not come out of the shock. Quick fact is real. See it here. It's real. God wiped away my tears. I'm coming back. Bring me back. I have more stories. I have more of it. See it here. See what I was writing.
I promise. Thank you so much. You're representing Nigeria too. I don't think you said it.
See this? I bought this. I said, God, this time around is for me. I have to wear a scrub. See, that's why I'm still wearing it. That's why I still have this. I didn't take it off so that people will know that it's real. It happened. It's real. See, this is from Walmart. You can see.
Yes,
it's scrub.
Yes. And I feel like I have the same scrub somewhere. I just bought the same one. Actually,
it's real. People are asking, is it real? It's real. I'm a human being. It's real. I'm from Nigeria, from Imo State. People, Nigerians should know Imo State. Imo State, Oru West Local Government, Imo State. That is where I'm from. People know me. Chijoke family, they know me. I said, the world will hear my testimony. This is real. I can't believe my dream. It's happened. Everything you were teaching, Professor, everything. The prioritization question was flowing like a river. Everything is real. I saw it. The pregnancy, everything is coming. I was seeing the whole thing. I'm like, this is all the things in V2 and quick fact. Father, is this real? I was smiling. 300 minutes. I was seated, 300. I refused to go and drink. Okay, bring me back another day. Let me, because it happened.
And it's so good. I'm sitting here listening, like, tell me more.
It's a lot. I told Pastor Mark that I have a lot. He asked me, like, how many? I said, it's a lot. I'm just jumping from each one of them, anyone I can. It's a lot. I need to write it. People are telling me to write a book. I need to write it. It's real.
I will. I'm going to bring you back so that you can share more of your story.
You are a blessing to this generation. God sent you. You are God sent. Do you hear me? Don't ever feel whatever people are saying online. Don't ever listen to any comments. Any negative comment is not for you. You are a special being. You are you are exceptional. You are. I can't believe it. I tell people, she's a Black American. She's a Black American. That's what I tell people. People are like, what? Black American? I said, yes. The one you people know. The one you people know that you think that they don't listen, they do it. So this one is exceptional. She is a God-choosing one. If all the Black Americans can be like her, oh Lord, I'm done.
Okay. Nurse Faye, thank you so much. We're about to talk about prioritization. I'm so glad you saw prioritization on your exam because it is a topic.
99% of the questions is prioritization question.
Yeah, gotcha. All right.
Don't play with it. Don't joke with it.
Okay, don't play. Okay, bye-bye.
Bye.
All right, bring more nurses. Let's get into prioritization, shall we? We got 500 people. All right. Why does prioritization matter? Why does prioritization matter? Why are we doing an entire broadcast on prioritization? Because if you want to be a nurse, you have to understand this very special principle. And remember, prioritization is not a topic for a beginner. Prioritization is something that after you've done V2, after you do this workbook, you will find that you are ready to prioritize. Actually, let me just show you this really quickly. I don't even talk about when you get your V2 workbook, especially if you're working with KenyanNurse consultants, they have all of the books in Africa already. So if you're in Nigeria, if you're in Ghana, if you're in Ethiopia, Zambia, they have the books there. But in all of this book, I do not talk about prioritization until the very end of the book. So all the way back here is where I go over prioritization. Okay, so you're watching the videos, but you have gone through all of essentially the course. So if you're going through this and you're not getting these questions right, you probably need more support with your content. Okay, so I asked this question, why does prioritization matter? Well, because in nursing, as you know, several critical events can happen at the same time. And you have to be able to categorize which one is the most severe out of the list that you're given on the exam. So there are a lot of ways that we can discuss, how do I prioritize something? How do I do it, Professor Regina? There are probably about 7 ways to prioritize in nursing. I'm going to talk about the largest 3, okay? And these are terms that as I'm teaching, I expect you to know. I expect you to be able to know these terms. And if you don't know them, promise me that you are going to look them up. Look them up. We're going to talk about Maslow's hierarchy of needs. How many know that? We're going to talk about ABCs. What does ABCs mean? Put that in the comments. And we are going to talk about the nursing process. The nursing process. So all of these that we see right now, all of these are principles that you are able to use to say, which one of my patients need my help now? Who is the priority? So let's start with the first one. The first one being ABCs, airway, breathing, circulation. If I asked which principle is the most critical, it's going to be ABCs. What? Why is that? Why is ABCs the airway, breathing, circulation, the most critical of these principles? Let's talk about it. Okay. And the way we're going to talk about it is I'm just going to give you a practice question. And this practice question does come from V2. So you will be able to find it when you're doing our question bank. You will be able to find questions just like this, just like this. Here it is. A nurse is working in the emergency room when 4 patients arrive simultaneously. Which patient should the nurse assess first? Number 1, a patient with slurred speech and facial drooping. Number 2, a patient with a gunshot wound to the left upper extremity. 3, a pediatric patient with a black eye and bruises around the ears. Or 4, a patient with a swollen neck after eating shellfish. Who is our priority here? Tap in. I should see 500 comments on the screen. I should see flooding. This is part of a discussion group. KenyanNurse consultants, they said, let's put on an NCLEX study group. And so we're in that study group right now. I see some people saying it's 2. I see some people saying it's 4. Some people are saying 1. So we're looking here at a prioritization question. Let me give you the answer. I'm not going to make you wait long. The answer is number, what do you think? It's absolutely number 4 here. Let's talk about it, okay? Number 4 is the correct answer. Remember, we're using the concept of ABCs here. And there's many ways we can prioritize, but we're using ABCs, airway, breathing, circulation. What is happening with number 4? What kind of problem does our patient is having? That is, what does it say? They have a swollen neck after eating shellfish. What does this sound like to me? So anytime I see shellfish, peanuts, some people are allergic. This is an allergy, right? After a bee sting, this patient is having an allergic reaction, anaphylaxis. So the neck is swelling. If the neck is swelling, then perhaps, right, the airway is closing. Perhaps he's having laryngeal edema. This patient cannot breathe. That's what's going to happen, or that is what's happening. This patient has an airway problem. Now, some people pick number 1, and this patient in number 1 is also critical because they're having what? Slurred speech, facial drooping. What is that? What is number 1 at risk for? What are we thinking that number 1 has? Number 1 possibly has what? Cerebrovascular accident, maybe having a stroke right now. So we have to be able to do these high-level thinking. Binish says right. Have to be able to do these high-level thinking tasks in order to prioritize. That's why I said this is something that you get better at the more you study. The more you come to our classes, you're going to feel more comfortable with this. So number 1 is having a stroke. So we have stroke versus airway obstruction. Airway obstruction still wins. Okay. Number 2, some people pick number 2 because they saw gunshot wound. Okay. Gunshot wound, but where is it at? The gunshot wound is the left upper extremity. So that's the left arm. Okay. So the patient has a gunshot wound here. Is that airway, breathing, or circulation? That's a circulation issue. So that is not going to be more serious than number 4. Okay. 3, the pediatric patient with a black eye and bruises around the ears. You think about it, what actually is the issue here? Black eye, bruises around the ears. We have to be very, very careful because this patient also is having that circulation problem. Okay, that's what this is. Bruises around the ears, circulation problem. So this patient number 3 would not beat number 4 either. Okay, good. Abuse, yes, abuse. Very so. But we're talking about airway, breathing, circulation. Ruth put up a question, and I like comments. Please put the comments in the screen. I think this is very important. Ruth says, number one, stroke that could lead to dysphagia, which is another airway problem. This is a good comment, because yes, it could, right? But when we are taking NCLEX, remember, we are only looking at what is in front of us. Okay, we are only dealing with what's in front of us. We are not going to go down a rabbit hole, or this gunshot wound can lead to bleeding, and then the patient may aspirate because the blood may get into their lungs or their mouth. So what we're going to do is we are going to look exactly at what is being presented in front of us, and we're going to pick the best answer from what's in front of us. All right, because sometimes when you know a lot, it's easy for you to talk about all the possibilities, but that's another distractor. It's not going to get you the answer that you need to get to. All right, so ABCs, remember, these are considered the major airway problems for the NCLEX. And as you can see, obstruction is the main thing that we're looking for, whether it's a foreign body obstruction, okay? And understand, you should know foreign body obstruction. Whether it is a burn, burns can cause the airway to close, okay? Allergic reactions can cause the airway to close. Trauma can cause the airway to close. When we discuss breathing means that the oxygenation of the patient, the ventilation in the tissues is no longer adequate. It's not a matter so much of obstruction. There is something else that is taking place that is causing poor ventilation in the cells and in the tissues of the patient. That's another big emergency. These are situations that you should absolutely know. So the first one is tension pneumothorax. If you have the V2 workbook, I just want to show where it is. Right here. Very important. You need to know tension pneumothorax. It's something that we go over in the chest tubes lecture. This is page 64 in the V2 workbook. Okay. So again, this workbook comes blank for the most part, because you need to watch the lectures as you are filling out this blue book. If you have quick facts, this book is the question and answer book. The answers are already in here. Okay, so this book looks like this. The answers are in here, but this is just half of the program. You should also be doing this part. So tension pneumothorax, gotta know it. Opioid overdose will cause the breathing to be decreased, the ventilation, asthma, COPD, and respiratory acidosis. All right. If you came to our study session last month, every month with KenyanNurse Consultants, we are doing a monthly study group. If you came to our study group last month, we did go over arterial blood gases. Very important for you to know. Okay. Circulation issues, shock, asystole, if you have any kind of hemorrhaging. And then another topic that I review that you must know is SIADH. That is syndrome of inappropriate anti-diuretic hormone. So as you can see, in order to be a great prioritizing nurse, you got to know content. You have to know it. All right, let's try another one. Can we try another one? How about this one? Which patient should the nurse assess first? I want to see the comments in the screen. Number one, a patient with asthma who is wheezing and using accessory muscles. 2, a patient with COPD on 2 liters oxygen via nasal cannula and reports shortness of breath. 3, a patient with a tracheostomy who has signs of increased agitation. Or 4, a patient with a neck injury who is making gurgling sounds with each breath. Now, this is tricky. Why is this hard? I don't see as many comments in the screen. I'm giving you guys an opportunity to comment. Okay, comments are coming in slower. Who's our priority here? And the answers are all different. All different. So I'm so glad you came to this class today, because there is one patient who is worse than all the others. Okay. So number 1, number 2, number 3, number 4. Yeah, this one is tough because, of course, this is how I like to write questions. They all have airway problems. So you cannot do A, B, C here. They all have airway problems. All right. I see the answers rolling in, and they're all different. Correct answer, you will have gotten it right. You will have cleared the NCLEX if you picked number 4. Number 4 has the most compromised airway. The most compromised airway. Why do you say? Why do you say? Because all of the other ones at this time, 1, 2, 3, they are still having ventilation happening. Okay. Number 1, you got it right. People are like, yes, yes. And that's okay. Even if you got it right, fantastic. If you didn't get it right, I'm glad you got it wrong here, okay, as opposed to on the exam. I want you to get the answers wrong with me because we can talk about them. So number 1, still ventilating. They have asthma. It's wheezing, okay, and they're using accessory muscles. So are they struggling? Yes. But are they ventilating? Yes. Right now, they're still ventilating. 2, person with COPD on 2 liters of oxygen. Okay, that's normal, right? And they report shortness of breath. Do patients with COPD have shortness of breath? Yes, all the time. And this person is actually getting supplemental oxygen. Is this our priority? No. This is not our priority. What about 3? Patient has a tracheostomy. What does it say about this patient? It says they have signs of increased agitation. So that doesn't give me a lot, but what I do know is that right now, this patient is still ventilating. But number 4, I have a patient with a neck injury, okay? They have some sort of spinal cord injury. I don't know what it is. And they're making gurgling sounds, with each breath, okay? Who needs the assessment? Who do I need to see first? I need to see number 4 first, because if this patient's lungs are filling up with fluid or blood or something else, then they may not be ventilating at all. Okay, so this is why number 4 is my priority. The question says, who should the nurse assess first? I need to go to number 4. Okay, and so are these questions challenging? Yes, but can you do them? Yes. Nurse Faith just said priority questions were flowing. I like the way how she said that on her exam. You got to be ready for the flowing. Okay, all right. I'm not going to stay there. I got to move. So we're going to go to Maslow's hierarchy of needs. Now, Maslow's hierarchy of needs is another way that we are prioritizing our patients, because it's not always going to be airway, breathing, circulation. It's not always going to be that. So with Maslow's, we are now looking at the emotional aspects of our patient. We are looking at their physical aspects, right? Because the most important for Maslow's is what's at the bottom. You usually see this pyramid or this triangle of these things. So you have first at the bottom is going to be your physiological needs. Everybody needs food, water, right? Everybody needs oxygen. These are things that are the premier of life. But also there's a component of safety and security. We need shelter, okay? Love and belonging. We want to feel accepted. We need to feel connected. That's another part of our existence. Your self-esteem. With Maslow's in nursing school, we learned how a patient sees themselves is also a part of their health, their mental health. and then our patient reaching their highest level of who they are, this is very important as well. And this is why we're here for you today, because we want you to reach the highest level. So if you see yourself being a nurse in the US, and I'm telling you, it's great, okay? We want to help you get there, because that's also you living a very fulfilled life. So for the NCLEX exam, prioritization by Maslow's, it's a thing. You need to be able to do it. Let's give it a try here. A nurse is working with a newborn infant recovering from open heart surgery, okay? Which order from the doctor is most important to the infant's recovery? Okay, so the newborn had open heart surgery. Which order from the doctor is most important in the recovery? Number 1, maintain strict contact isolation precautions for MRSA. 2, nurse is to check wound dressings for bleeding. 3, parents are allowed at bedside. Or 4, notify MD for all laboratory values. Here we go. Can't use airway, breathing, circulation here. It's not the priority, okay? But you see this word most, and you're going to see that, all right? Most, all right? Or highest. Okay. Whew. And remember, everything that you need to pick the correct answer is in the question. So I'm always telling you, look at the question for your answer. Okay. All right. Correct. And I see there's 1s, 2s, 3s, 4s in the comments. So we're not all on the same page right now. We're all looking at it in very different ways. Let me show you how NCLEX wants to look at this. Correct answer. Boom. Number 3. Why is number 3 the most important? Somebody who, whether you pick number 3 or whether you didn't pick number 3, number 3 is the right answer. Somebody tell me why. Okay. Somebody tell me why. Let's get into it. Let's use our training. Let's look at the entire patient and let's talk about what is most important. Okay. Somebody tell me why. Newborn. Yes. I love this. Barbara. Isolation in the newborn is going to delay their healing. Okay. Newborns need to have what? And we all need it. Okay. But newborns need to have extreme amounts of physical contact, touch, love, cuddling. Those things are important because in the newborn, the bonding, yes. In the newborn, it reduces stress and it allows their body to heal. So if NCLEX is giving you the age, especially next gen, and this is new for next gen, if next gen NCLEX is giving you the age of a person, it's important. If they're giving you the race of a person, it's important. Okay. So we have here, this is a newborn infant. This infant they need their parents at the bedside. They need somebody that is going to be giving them a lot of love, bonding care. Okay. Does that make sense? All right. I got to move on. Next one is this. Okay. And let me tell you this. Maslow's is very tricky when you get these types of questions on NCLEX because you have to consider concrete facts and you also have to think about abstract things. So like isolation in a newborn or lack of physical touch, or if a patient is restrained, how is that going to affect their mental health? Things like that. Okay. Physiological needs are not always the priority. This is not ABCs. Okay? Sometimes safety will be more important than physiological needs. So you have to really be looking at the context of the thing that we're talking about. That's why I'm telling you, look at that question. What is it telling you? Let's try this one. Okay. A nurse is caring for a 68-year-old male patient who was admitted with severe dehydration. The patient expresses feelings of loneliness after losing his spouse. He has been refusing to eat and drink. Which intervention should the nurse prioritize? Number one, arrange a consultation with a social worker to discuss grief. 2, offer the patient oral rehydration therapy. 3, invite the patient to today's group therapy. Or 4, encourage the patient to talk about his feelings. What do you say? This is a good one. Hey, I got over 700 nurses studying for the NCLEX exam. This is the biggest NCLEX study session right now on the planet. I guarantee you, there is no other place where 750 nurses are gathered around. Not one. Okay. So what do I have in the comments here? A lot of people are saying it's 4. 1. Where did I tell you to go for the answer? We are going directly to that question. The right answer is number 2. Offer the patient oral rehydration fluid. Why is this the most important? Why is this the most important? What information have you been given? What information have you been given? For those of you, maybe for those of you who didn't even get it right, but now that you see the answer, you're like, I should have seen that. I should have saw it coming. And this is how NCLEX can be very tricky. Okay. This is why you got to show up, because this patient has what? Severe dehydration. And you as the nurse, you're there for medical interventions. It's great if the patient can talk about everything, but at the end of the day, the intervention that the nurse needs to prioritize is getting oral rehydration fluid to this patient. We have to, because if dehydration persists, then what can it turn into? Okay. All right. Okay. The nursing process, and this is the last one I want to look at, because like I said, we could do priority in so many ways. We could do time priority, acute versus chronic, so many things, right? And we will work together. We're going to make sure that before you test, you have everything you need. The nursing process is the premier, right? I would say ABCs is the most critical, but understanding prioritization based on your nursing process is what will help you to be able to get through many more scenarios, especially now that with Next Gen, we're doing case studies. So this ADPI, we know what ADPI means: assessment, diagnosis, planning, implementation, evaluation. If you have a good command of your nursing process, your critical thinking will be so much greater. Let's try it. 72-year-old patient with congestive heart failure suddenly reports shortness of breath and has bilateral crackles upon auscultation. The patient's oxygenation saturation is 84%. What is the nurse's first action? Number 1, assess the respiration's depth and frequency. 2, administer the prescribed beta agonist. 3, notify the physician. 4, elevate the head of the bed. Let me read it again. 72-year-old patient with CHF reports shortness of breath and has bilateral crackles upon auscultation. The patient's oxygenation is 84%. What is the nurse's first action? You have a list of actions in front of you. What do you say? Okay, yeah, you guys are warming up. I've been throwing a lot of difficult scenarios at you, but I'm doing this to train you. Okay, correct answer. If you pick number 4, you were in the appropriate place in the nursing process. If you pick number 4, elevate the head of the bed, you were right where you were supposed to be in that nursing process. Why is number 1 not the right answer? I saw a lot of number 1s. Number 1 is not the right answer because guess what? You already know everything you need to know. The assessment, I like this. Assessment's done. Assessment's done. Patient short of breath. You already know bilateral crackles. Oxygenation is 84%. I don't need to know anything else in order to act. Okay. Do I need to do the diagnosis? No. Why? Because I see what the diagnosis is. Congestive heart failure. I don't need to do nothing else, right? Do I need to sit back and plan anything? Am I looking, okay, what is the patient's diet going to be? What is their activity going to be? Nope, past that. My patient is in trouble. I need to act. I need to do something, right? So I could notify the physician. Rarely is that going to be the right answer for NCLEX because there is always something you can do. There's always something you can do for your patient before you call. Because if you call the doctor, let me tell you this, okay? Especially if you're coming to the US to work, nurses in the US are empowered with a lot of responsibility. And so the nurses are usually the ones that are saving the patient's lives. And I'm not just saying this because I'm a nurse. I'm saying this because when you call the doctor is going to say to you, what did you do? Or what should I do? That's how that works. Okay. The doctor more than likely will say, what do you want me to do? And that wasn't something that I was prepared for when I got out of nursing school, but it happens. Why? Because we're there with the patients. So never leave the room without doing something for your patient. And in this option, we have elevate the head of the bed. Elevate the head of the bed. Seems very small, but it puts your patient in a better position for those abdominal contents to relax and your patient's lungs to expand. That is what the first action should be. Okay. And then you can go and call the doctor, but you need to do something for your patient. Okay. Number 4 is correct. All right, let's do some more practice questions. This was a short study session, but at the end of the day, what we're trying to do is make sure that you are on the right path to getting where you need to be, and you don't have to do it alone or the difficult way. So let's do some more practice questions and think to yourself, how am I doing today? Am I getting these right, or do I need to remediate in this area? Okay. All right, how about this one? It says this: the nurse monitors 4 clients receiving treatment in the medical unit. During the morning rounds, which client should the nurse evaluate first? A client with diabetes mellitus for a blood glucose check. 2, a client with thick mucus secretions. 3, a client with an order for a daily wound dressing change. Or 4, a 13-year-old patient prepared for a cranial CT scan. Ooh, Who should the nurse see first here? Who do you say? I see it. The comments on the screen are very good today. So many, I can hardly keep up with them. But most of you are saying, I would see 2 first. Let's see if that's the right answer. And it is number 2, goes back to our ABC question, airway, breathing, circulation. This patient has an airway issue. And honestly, for me, if you are getting ABC questions on NCLEX, you should be getting all of them right. Every last one of them, I want you to get right, because these are going to be the easier prioritization questions that you can get. Okay, let's do another one. A registered nurse was assigned to triage in the emergency department. 4 patients arrive at the same time. Which patient should the registered nurse prioritize to protect other patients from the spread of infection? Number 1, a patient after a tuberculosis infection. 2, a patient with suspected chickenpox. 3, a patient with a family history of pertussis. Or 4, a patient with an infected wound. Who are we going to go with here? And I'm so happy to see a lot of my REMAR nurses that come to my Monday and Wednesday class popping on here as well. This was a very special, actually, I was really excited about this particular class today. Talking about prioritization. Are you feeling good? Are you feeling good about it? Correct answer here is going to be number 2. A patient with a suspected chickenpox case. We need to isolate this patient. Number 1, some people pick number 1, a patient. It says tuberculosis, but it says after a tuberculosis. So you have to be very, very careful because this is after the infection, not during the infection. So we need to prioritize number 2, who we're not sure. We don't know for sure what the patient has. So number 2 is the correct answer. All right, let me ask you this. Okay. If you are in Africa, okay, KenyanNurse consultants, they have expanded their offerings to you. So I'm going to bring in Nurse Paul so he can talk about how you can sign up, how you can get your V2, your books, and also you can get your training, okay? So Nurse Paul, hi, how are you? Welcome back. Hello.
I've really enjoyed your lesson. I think I'm now able to prioritize whenever I'm responding to these questions. They seem to be easy to pick, but you have to be really keen. And for those nurses who are looking forward to get more details, more information, more resources in terms of books, we are able to actually serve them right from their home, especially if you're in Kenya. We are able to have you pick your books from our regional office. We have several offices, and our headquarters is in Eldoret. You can come to Eldoret at Kenyatta Street, the Anga building, just 4th floor, and that is 410 and 411. Or you can call our number that is on the screen, +254 716 192 248. And those in Nairobi, we are in Westlands at Wayaki Way Road and Woodfall Group at the Krishna Towers. While there, you can call our number and we shall be able to actually have you access those books. Those in Kisumu, we are also on Okingo Dinga Road, just close to actually the provincial hospital at the Kisumu hub. While there, we are just at the Mecca Blaster Wing, B, 10th floor, and we shall be able to have you get your book. Those in Kisii, we are also in along Hospital Road, opposite the Paramount Plaza, Keiko Road, Keiko building, and we shall be able to serve you from 2nd floor, room 207. Those in Kampala, we've also not left you out. We are able to have you pick your book from our office, which is just in Tuatule Road, just opposite next to Eliana Hotel and opposite to Sals Hotel. And those in Mombasa, I'm happy to share this information with you that you are able to pick your books from our office in Mombasa, which we are going to share the details in our various social media sites. And those in also Nakuru, we have also established an office in Nakuru, which is at the Nakuru box. You are going to meet our staffs who are wonderful there to actually guide you, be able to physically have a conversation with you, guide you, and be able to give you the gifts and also the books. Those in Kakamega, we are also coming home and we shall be having our office soon in Kakamega. And we are doing all this just to ensure that we are able to actually be close to you so that you have all these resources close to your home. And if you are a nurse in any other African country, we've not left you out. We've had a great partnership with DHL. We are able to actually send these books to your address. We have done several dispatches to Nigeria, Ghana last week, and we are looking forward to send as many books to any of our sisters, brothers in any of our African country so that they can be able to access these resources from the support we are getting from Professor Regina. So don't shy off, just reach out to us and we shall be able to either have you pick those books from our office or we shall be able to send those books to your address. And we are doing this because we know you have no other option. You must pass and you will pass NCLEX. And we are here working with you through this journey.
Oh, Paul. So the best way, what would you say the best way for the nurses to get in contact with you? Is it just give a call? Is it send an email? How should they go about doing it?
Yes, nurses are able to reach out to us through several ways. They can call our number, which is +254 716 192 248 if they're in Kenya. If they are not in Kenya, they are able to WhatsApp that number, and our staff is always available to respond back to them. And if you are a nurse who fancy the email, our email is on the screen, customerservice@KenyanNurse.com. And maybe if I can just try to take through those nurses who are looking for when can I start, how can I start? The first thing you have to do is contact us. If you are able to contact us, you can still make the payment and you can still actually come to our office. You can still have a WhatsApp call, you can have a direct call, you can have an email, and we shall be able to respond to you. And for those of you who are looking forward to join us soon, our next intake is going to commence from actually 1st of September as we speak today. After this session, we are going to pick up immediately and have the group to at least start their journey. And if you are planning to join us, you're not late. I want to welcome you. It's never late. Going to open this the whole week since Professor Regina has just had a session today. I'm going to open up the whole week from today up to Friday. We are still going to take up nurses as they come in. So if you wish to make payment to us and you're in Kenya, allow me to take you through the payment process. And it's going to be through only one method, that is through our pay bill. And you're going to send money to our pay bill, which is actually 4084929. If you can take a screenshot, if you can actually be able to have that screenshot in your phone, you are able to refer to it whenever you're making that payment so that you don't make a wrong entry in any part of your payment process. And you enter your official names as your account name, and we should be able to know that Nurse Paul has made the payment. And if you're in Uganda, you are also going to be able to make a payment to us through MTN. You can go through MTN and pay to our Ugandan actually account, which is Centenary Bank. And for you to do so, you have to press *165#. Then once you press OK, you're going to have options to choose from. Choose option 6, which give you financial services. And after that, you choose now option 1, which give you the bank deposit. Then it is going to give you list of banks, Ugandan banks. Choose the Centenary Bank and enter our account numbers 3100101721. Once you have done so, you're going to confirm with your MTN PIN and everything will be okay from your end. And you can be able to email your payment confirmation to customer service at KenyanNurse, or you can WhatsApp the same payment confirmation at +254 716 192 248. And we shall be able to actually have you get admitted in the famous V2 immediately. It takes few minutes, you will be already admitted. And that is how our process is faster. And it's faster because if I'm going to explain to you how our process is faster compared to other process, you're going to be surprised. So those actually who are not in Kenya, who are not in Uganda, and maybe you are in the UK, you are in Nigeria, you are in Ghana, you are in Ethiopia, you are Zambia, Zimbabwe, you wish to make payment to us, you can just email us your name and your email, and we shall be able to send you the payment link. Email those details to customer service at KenyanNurse.com. Just email Rima NCLEX Training, and we shall be able to actually send you the payment link. Once you make the payment, we are going to actually send the books to your address, directly to your address, and we shall be able to pick you from there and work with you step by step, as I explained earlier, through CHFNS, State Board of Nursing, Pearson VUE, the identical process that actually appears to be so complicated. For us, we make it so easy. And our candidates are actually getting all this process done. Within 6 months, they are able to be USRN. And that is what we are looking for. There's nothing beautiful that you can give to yourself this year as that crown as USRN. And for those of you who might actually be asking around how our process is different from the other agencies, remember, if you are processing with other agencies, each and every step, you must be approved. For example, I normally use this example. You're going to send a CV to request whether they can consider you. You're going to send a CV on 29th of July. That CV is going to be received maybe on 15th of August. Once it's received, it has to be queued. Once it's queued, they are going to reply to you maybe on 30th of August. So that period that you're pulling each other with responses, and maybe they send an email on Friday. Most of you maybe check emails only on Monday, Tuesday, on weekdays. You check that email on the next Monday. Already 1 month is done. And before you are moved to another step, maybe CHFNS step, you have to be approved. You have to go through rigorous interviews, clinical interviews, a lot of questions, and you have to confirm to them that actually you are able to actually meet up their requirement. And that already, you are buying time, you are wasting time. So before the retrogression hits you, you've been hit by series of retrogression. So each and every step, you are retrogressed, you are queued. For us, we've done away with all those conditions. We've made it open, we've made it easy, it's spot on. You make the payment, you are admitted immediately, you start your training immediately. The next time, the staff is going to reach out to you. Your next step is CHFNS. You make the payment for CHFNS, you are able to move so fast, and you'll be able to have your sales report within 2 months, your State Board of Nursing and the Pearson authorization within 2 months, and within 6 months, you have your USRN. So that gives you a reason why you actually have this power back to your hands. And we are going to give you more power. We're going to give you more resources to ensure that you become a USRN within 6 months, because you are going to pass this NCLEX. You must, and you will pass NCLEX-RN.
Wow. And so one more time, for those of you who are outside of Kenya or Uganda, what we are asking you to do is you can email, take a screenshot right now. Take a screenshot right now, because you can email or you can WhatsApp. You can email or you can WhatsApp. Everyone that I'm seeing, hey, everyone that I'm seeing that is like, oh, I'm here or I'm there. And I will tell you, I have worked with many agencies, many staffing agencies, who want to utilize the nurses in Africa, right? They want to bring you onto their company, but they won't give you the same type of support that I've seen here. The support that you will get is a white glove treatment. We call it white glove treatment here, or concierge. If you ever have gone to a hotel or you stayed at a nice resort and you had a personal concierge to help you with everything, they make your appointments, they set your dinner reservations. This is what I feel KenyanNurse is doing. They go the extra mile in order to help you get it done faster. There is a slow way and there is a right way. KenyanNurse is doing it the right way for you. And so in all of my teaching, I've never seen anything like what they are doing. So what I want you to do is take the first step, and that's just sending an email. Just sending an email or calling the WhatsApp, and you were able to get all of those questions that you had. And I will tell you, from Remar, there is no other partner coming from us from Africa. These are our partners. So if you are in Africa and you want to come to the US, you want to come over here where I am right now, this is absolutely the best way to go. And I never give you guys recommendations that I don't full-heartedly believe in. So send them an email. And again, I'll put it up really quickly so you can screenshot it. But we have just finished a very important part of your studying process. However, there is much more that needs to be covered. So when we are done here, I expect you to get out your book, go into V2, and watch the next lecture, wherever you are. Okay, you're going to go over, and this is why you need to have the lectures, because you're going to go over all of these subjects. Okay, you're going to go over all of these subjects with me in the V2. Okay, and that is going to help you be able to get these types of questions right. So we had a good study group. We will be planning another one. Actually, somebody asked, hey, if you are an RN or if you are a PN, the September 1st intake is ongoing now with KenyanNurse Consultants. So don't miss this opportunity, because I know that they provide such a high level of service that they're only doing intakes at certain times. So we are right at the point now where you are able to get in and get started, So do not delay for this important task. Okay. All right. And now we have this question right here. I want everybody to answer it. Were you an NCLEX safe nurse today? In your answering questions and you showing up for class today, were you a safe nurse? Okay. The answer is either yes or no, or the answer is even yes, I did. I was a safe nurse. No, I want to do better the next time we have a study session. But at the end of the day, you have to be a safe nurse in order to pass the NCLEX. So if you want to, right, I asked the question, do you want to study more with Remar? Do you want to study? Did you enjoy this study session? Was it, dare I say, fun? Was it, dare I say, interesting? You know, some people are, they don't think studying can be fun, but it is. It is. If you're interested in your subject and you feel like you're studying in a safe place, it can be fun. So I see some people saying, I wasn't as safe as I should have been. I want to do better. I like that. I want to do better. So if you're interested in studying with us, we absolutely will have another one of these. But again, it is to support those who are already on the journey, because what we do right here is not the review. Okay. It's not the full course. It is to help motivate you to take the big step. It's to help motivate you to take the big step. So I say this because I truly believe it. I can. Yes, I will. Yes, I must pass NCLEX, because by God's grace, you absolutely can do that. You can, you will, you must pass NCLEX. You have to believe this. All right. You have to take it into your mind and your heart, because there are many more challenging things that you have already overcome. And so this will just be one of them. And it was such a pleasure. Thank you, KenyanNurse Consultants, for bringing me on today and having this study session. And I'm looking forward to when I come and we put on our classes throughout the whole of Kenya, how exciting they're going to be. I hope to see you there if you're in Kenya. And we will continue to support you on your journey to becoming a USRN. Yeah, we will continue to help guide you step by step so that you are able to take control of the process, because it's your dream. You have to own it. So thank you all so much for your time today, and I will see you again. Remember, you can, you will, and you must pass NCLEX, because with God, it's possible. Bye-bye. Oh, wait, Paul, did you want to say something before we left? I didn't want to cut you off. Do you want to say your final farewell? I didn't see you.
Yes, I must appreciate the time nurses have taken to be here with us, to listen, to respond, to be able to actually challenge themselves It's really something that we take it seriously and we really appreciate. And also, I wish to appreciate you. I know you have a busy schedule. You are actually always available to support our nurses. I really appreciate. For the team that is behind you, Mark, Abigail, and Vance, I really also wish to say thank you so much. And we look forward to welcoming your team in Kenya. Those of you in Kenya, I wish to share a secret. She is coming back in Kenya for a
Yes.
whole 1 month. So prepare wherever you are. Maybe if you know that she needs to be in your city, you can just tell us which city is that in Kenya where she should come there. And I'm sure Uganda, we are also working on ways on how she can also come to Uganda. And soon we are going to communicate that. And as she said, we have made special requests. She's always a busy person. However, we've made special requests that at least she give us once per month sessions, which she agreed. So next session, we're going to communicate in our social media, in our emails, in our contact, in our various means. Check out your email. We're going to tell you when again we're going to have fun. I personally have enjoyed. Thank you so much, Professor.
Oh, yes, it was very, it was. We're going to just start saying the word fun because it was. We had a great time today. Thank you so much for Nurse Faith for coming on, giving her testimony. And I'm looking for the next person who will be a testimony for us. Who's going to come on here next time and tell us that they indeed passed NCLEX? I cannot wait to see you and meet you all. So as I say again, farewell. God bless you all. And until we meet again, bye-bye. Thanks, Paul. Bye.